This is Part B, but Mark Schad, you all are also aware of, is the lead for finance as well, but this is Part A. So the divide is still going to be there. Jared will be the lead for Part B, and Mark Schad will be the lead for Part A. Alfred Cortez, he's does quality assurance, quality management. He usually attends all your site visits. That is going to continue again this year. So he's going to continue being the lead over quality management, any provide reports, and anything you all need as it pertains to data visualization. So for example, we do the dashboards, case management dashboards. When you submit tickets for those, it's Alfred who does a lot of the work and sends you those reports. We also have a case management hotline that you all that we've advertised in the past and given you sort of AFC swag that has the logo on it. So we're going to still continue using the hotline. And then lastly, or two more things, Eduardo Villanueva, he's the insurance lead. So when it comes to medical benefit activities, when it comes to insurance enrollment, when it comes to training case managers about insurance, they are the lead for that. He does have a team. He does have a team of 2 other individuals, and their role is to assist case managers in navigating anything related to insurance benefits. We will continue this year as well to get medical case managers through Part A and Part B certified to be able to be insurance enrollers. Again, this is not mandatory, but this is something AFC offers. So if anybody's interested in that, we can continue to do that as well. So Eduardo is the lead for that. I just realized I did not provide you the number for the case management hotline for referrals. The number for that is 312-690-8860. I'll repeat that, 312-690-8860. And again, that number is the number we advertise for all clients to call us for enrollment into case management or any of the other Part B services. Last but not least, Mara Williamson, she is our training manager. We are trying to hire a training associate to assist Mara with the trainings, but anything trainings related, please contact Mara Williamson directly for that. All of the folks I've mentioned on this list, other than the finance folks, are also users of our ticketing system, JITBIT. So any questions you have for any of these individuals can be sent directly through our ticketing system, and they will be able to receive it and respond in a timely manner. Any questions so far on the 2 slides I've gone through? Any questions? Great. Okay, so moving forward, wanted to reiterate the eligibility criteria again for Ryan White Services. There was one change last year. Other than that, most of the eligibility criteria are the same. So again, clients have to reside in Chicago EMA, so Cook County or the Collier counties for Part B, but I've listed all the counties that we work with on this slide. Please note, as it pertains to Part B, when we provide agency contracts, it actually specifies whether you work with clients that reside in Cook or the Collier counties. For case management, it's open. You are able to provide services to people that reside in Cook County, in the suburbs, and vice versa, because again, some clients may not prefer to receive services in the area they live and want to sort of go out to the suburbs to get those services. So that's completely okay. But when it pertains to other service categories, the contract specifically states Cook or Collier, and some agencies have both contracts that they are able to serve both Cook and Collier clients. I mentioned this specifically because of billing, because if your contract specifies that you are to serve Cook County clients only, and the provider, let's say a dental provider, provides dental service to somebody in the collar counties, and provide, the system would automatically mark this as not billable because your agency does not have a grant to serve that county. So just making sure you're serving clients within the language sort of within your contract. And if there's any questions about that, again, please, I would be your lead for that. Please contact me, and if there's any workarounds we can provide, we'll be happy to do that. Other eligibility criteria income. So majority of our Ryan White services, the FPL level is 500%, which is about 63,800 for a family size of 1. This is again for all services except case management. In the past, case management has not had a limit in terms of income. You know, you could make $1 million and still qualify for case management. Last year, a cap was implemented for income for case management, which is at 800% FPL. It's about $102,000. But again, we did an analysis in-house to see how many clients would be disqualified, any existing clients that would be disqualified, and there were only 2 clients. So hopefully all the clients that need services are still able to be served with this, with the implementation of this federal poverty level limit. 4th is HIV positive. All clients we serve must be positive. And last but not least is in terms of payers, we need to make sure that we're looking at all other payers for the clients prior to providing a service. As you all know, Ryan White is the payer of last resort. So if somebody has Medicaid, Medicare, or private insurance, we need to tap into the insurance first, and then use Ryan White as a payer of last resort. Okay, so let's go over some program requirements. Again, these are things that you've seen before. We have quarterly reports, both Part A and Part B. They're due usually on the 10th of the month. I've outlined the months that Part A quarterly reports are due and the months that Part B are due. Please note that these are separate because they do fall in separate program years. The Part A program year starts March 1st and ends at the end of February, and the Part B program year starts April 1st and ends at the end of March. So please note these report timelines down. These reports are submitted directly to Lakeithia Patterson. She reviews the reports, the successes, she looks at sort of the areas for improvement and any technical assistance asks that come from providers. Her role is to really do a deep dive and then contact you all when there's any issues or any technical assistance that you need help with. So Lakeithia is the lead for that, and once we receive it, we usually send an email back to the person that submitted it, letting them know that we've received and that we've reviewed the reports. So nothing changes with that. We do need a quality management plan. So every year when we come out to your site visits, we always look to make sure you have a QM plan. And the most important part of it is some of the QI initiatives that you outline. So we want to make sure every year you're identifying quality improvement initiatives that you all want to work on and track the progress towards those initiatives over the course of the year. So when we come out for site visits, we're looking to see what your goals were, what you did towards the goals, and where you are in terms of performance towards the outcome that you wanted. If anybody has questions about this or needs technical assistance as it pertains to quality management, Alfred will be the lead for that, and we're able to come out to your agency to provide that TA. Moving on to contract administrators meetings, those will continue this year. We have them every 2 months from 10 to 12, and they're usually here at AFC. So those will continue to happen. This is a meeting where we give updates about what's going on within the Ryan White system. We give any policy updates, we give updates about the programs and any changes coming up. And again, I have a chance for administrators to sort of mingle, network, and also ask questions of us as needed. And a lot of the meetings I've talked about, so the contract administrators meeting and the QM plan TA, if needed, we do have conference call-in option as well. So we can do that. So keep that in mind when you want to request TA. Annual site visits, those are annual. We'll come out to your agency every year. It's usually a representative from programs. So Lakeithia is the prime representative from programs. We have Alfred representing the data team, and we have somebody from finance representing finance. So it's usually a team of 3 that come out to AFC. Nothing is changing with this process. Again, our goal is to pull the data and the performance measures beforehand, so that when we do come to your agency, we're spending a lot of time really talking about technical assistance, talking about some of the successes we see and you all see with the program, just talking about trends and talking about any needs or support agencies need. And we really love the site visit period. I know a lot of agencies get scared when we announce site visits, but really we take this as a time to get to know our partners better and really just have better collaboration. Again, all services must be documented in the Provide database. With Part B, Provide is not going anywhere. They just signed a lifelong contract. So Provide is still going to be the database we use across the Part B system. Part A, case management as well as financial assistance. Provide continues to be the database that we all use and record. So again, please make sure you're documenting in a timely manner. We submit reports all the time using the Provide data to our funders, assuming all your data is in. So please, please, please enter your data on time so that we are sending our funders the most accurate report as possible. Okay, so here's some information regarding case management specifically. There are some certain trainings we have every year and wanted to outline those trainings and meetings. The first one is the case manager supervisor training that is offered here at AFC every quarter. We usually get feedback from case manager supervisors and some of the topics they want to sort of learn about or get better at, and that's how we sort of get the agenda for the quarterly trainings for supervisors. We are going to continue to have the large case manager meetings / trainings. It's going to happen every 6 months. Right now, we've been using the University Center on State Street to host those trainings. This year, we'll be looking at other venues as well. That's more convenient, accessible to transportation, but also more convenient for AFC in terms of flexibility with bringing food in from different vendors, and just some of the things we were not able to do with the University Center this year. So University Center is still going to be one of the venues that we use, but all that to say, we will be looking at other spaces as well. AFC does have a large conference room here, but it is not big enough to accommodate all the case managers and their supervisors. There is also a Case Management Collaborative Leadership Council. That's a meeting that happens every month. On the months that agencies are at AFC for the contract administrator meetings, we have that meeting in person from 9 to 10. And on the months where the providers are not here at AFC, it's a conference call. These conference calls are led by the chairs of the Case Management Collaborative Leadership Council, and that is not AFC. The chairs are from our partner agencies, but we do have AFC on the line responsible for minutes. If any of you are interested in being a part of that group, there will be an application posted on the AFC website, and we'll be talking about it more within the next couple of months. Supervisors can apply to be part of this group, and really the goal of this group is to provide advice to AFC on policy, on programming, and just really anything that would help make case managers' lives better, improve the case management experience for clients, and just improve the case management program in general. Lastly, the 12 training requirement still stands this year. There are some changes. So the Part B changes include that they no longer require cultural competency trainings every year. It's been changed to every 2 years. We will send communication to all case managers once we confirm that CDPH will follow this as well. But either way, we'll send out communication, but we know for Part B, they're requiring it every 2 years. And then HIPAA, making sure everybody has HIPAA training every year that is compulsory. There are other trainings, for example, the mandatory reporter training that needs to be completed by case managers upon hire. That's still going to continue. Case managers are supposed to take that within 3 months of hire. So once you do your online portion of the cultural competencies training, we'll include that information so that case managers take the trainings about being a mandatory reporter. Okay, so now we're going to go into the service categories that we have funded. These are I'll point out some of the changes first. You'll notice perinatal case management and corrections case management as sort of part of the portfolio now. Just to let you know, there was a Part B RFP released in December to compete for the lead agency, and part of their changes within this application is that both perinatal case management and corrections case management are now part of the lead agency in the Ryan White portfolio. So some changes that will happen. We're still waiting to hear back the results of the RFP, but those are changes that will be part of that RFP. Other changes this year is, you all know that non-medical case management is no longer funded by Part A in the way that it has been in the past. The funding still exists, but the funding has sort of been given to population-centered health homes, and they're able to use it to meet their needs. So the non-medical case management funds may not be used in the exact same way that they have been used under AFC's purview, but that funding is still available and lives at the population-centered health homes. This is Part A funding specifically. Part B still funds non-medical case management, and we've upped the FTEs by about 2 FTEs, so still not a lot. So it's going to be really tight when it comes to medical case management, but hopefully we can lean on some of the population-centered health homes to provide some of the basic services that clients may need. The other change, I would say, specific to housing is that once we did our RFP late last year, we did not have any agencies propose to fund bridge housing. So bridge units will no longer be a thing this year. And bridge units were really our way of providing emergency housing for clients that had emergencies and needed to be out of their house within 24, 48 hours. We had subcontracted with a provider to get them housed within that amount of time for a 3-month period. So that funding will no longer be available. Okay, so now we're going to dive into specific service categories and just some highlights for each of the service categories. The first one is medical case management. The caseload for medical case management remains at 45. Please note that I believe it was a year ago that it was 60, and we received feedback from case managers that 60 was too much to provide quality services to each client. So we did reduce that caseload to 45. This year as well, we continue to promote field visits. Field visits is part of every case manager's job description, whether it's medical or non-medical, and this is a way of meeting the client where they're at. Case management is not only supposed to be an office-based model where the client sort of comes to your office and provides and sees you for services, but it should work both ways, where the client can come to you if they prefer that way, or you are able to go to them, whether it's their home, whether it's in the field, whether it's at a park, whether it's at a library, but really making this fluid so that we're really helping clients in the way they want to receive that help. And hopefully this helps with retaining clients that are usually lost to care. This helps with retaining them in care. Partner elicitation. This has been, we've talked about this over the past couple of months. It's not new, but it's been just more prominently talked about by our funders, both Part A and Part B, so CDPH and IDPH. You all know that there's a partner service agreement form that was implemented by the state. And we've sent emails to all case managers about the new partner services agreement form. But please know that CDPH also is pushing partner services through all its Ryan White service categories. So again, partner elicitation, the role of case managers is not to provide partner services, but really use it as a tool when you have the client sort of in front of you, and if they're comfortable to do so, get in partner's name so that we can then send it to prevention, who is then responsible to do the partner services work. So again, we've heard you in terms of needing additional trainings about skills needed for partner elicitation. We are working with the state, we'll work with CDPH as well to provide that training so that you all feel comfortable to do it. But we want to continue to reiterate that this is going to be a part of case management, and these are conversations that need to be had with clients every 6 months. There is, so care plans are still part of case management. It's every 6 months, but we've been working with the state. There is a case management group that works with the state, and this is case management from all the regions that are funded. They come together and really inform the state about changes to case management as well. And one of the big items they've been working on is a new care plan. So there's a new care plan that's going to be coming soon. We do not know when. We know it's going to be a lot easier than what it is right now. So please stay tuned once that new care plan has been released and provide. There'll be trainings to sort of guide everybody on how to complete it, but it's supposed to be more streamlined, supposed to be easier to complete than what it is today. Again, FPL for case management, for medical case management is 100%. And then one change as well is with payment requests. Right now, case managers are able to submit payment requests. We are going to only be allowing 6 months in back billing. So what we see happening is their payment requests submitted and provide for clients' medical bills, and those bills are from a year ago, a year and a half ago. So it's really eating into the funds we have for this contract year. So we're implementing only 6 months of back billing allowed for payment requests. If you have any questions regarding that, Lakeithia Patterson is going to be your lead.
Where can we find guidance?
So there's a question, where can we find guidance on field visits? We are creating, I think it's in the final draft form, but we have been working this contract here and creating a field manual that includes all components of doing a field visit in terms of safety, in terms of equipment, in terms of privacy. So we will be releasing that within the first quarter to case managers. Okay, so let's move to non-medical case management. The caseload max remains at 100, and really this is because the model for non-medical case management is it's not an in-depth sort of visit with your clients. These are clients that are self-sufficient and need some guidance here and there, and maybe need some referrals. So we believe that a caseload of 100 clients is doable. We are yet to build performance measures in Provide, but the performance measures we're looking at really is making sure there's a face-to-face visit every 6 months. non-face-to-face contacts every 3 months. So this could be a phone call, this could be an email, this could be a text. And then according to the Part B program, they are stating that care plans are no longer required for non-medical case management. Until we see written guidance on this, we're going to work as status quo. But again, that's something to look forward to for non-medical case management, that care plans may no longer be required. But again, please continue to complete your care plans until we send final communication about this. And once again, non-medical case management is Part B funded only. Okay, so in terms of ambulatory, again, this is outpatient specific medical visits. It's a fee for service, meaning we do not pay for salaries for providers. We pay these agencies based on each client they serve and what service the client receives. The model for fee for service is that the service is provided and then the provider bills us after, and then we reimburse them. For an ambulatory service to be paid, we need an eligibility assessment and a care plan within the Provide system. If any of these documents are not present in Provide, the bill automatically is marked as unbillable. Please note that eligibility assessments and care plans are documents only created by case managers, meaning everybody receiving an ambulatory service should be case managed and should have an eligibility assessment and a care plan. We get a lot of questions about why a client's bill was not paid for a certain service category, and a lot of the time it's because an eligibility assessment was not in place, a care plan was not in place as well. So please make sure these two things are always in place prior to billing. Documentation is required by the 10th of every month for prior month. This is specific to billing. So all agencies that are funded for ambulatory services, they are to bill for example, all bills for January are submitted to AFC by the 10th of February. So it's always a month behind, but make sure bills are submitted and provide to AFC by the 10th of every month for the prime month. The requirement for invoices is still there. So for every service provided, there should be an invoice scanned into Provide as well. Payments are made by AFC at the end of every month for the previous month. So I know there's a lot of questions when case managers submit payment requests asking when we're going to pay for them. Again, AFC makes those payments at the end of every month for the previous month. So there may be a 60-day lag there if data is entered in the first of the month. Oh, that's a repetition, so ignore that one. And then this includes payments requests as well. So when I refer to the data entry the case managers do to request payment for client bills, this is the same thing here. So if you submit those payments by the 10th of the month, we will pay them by the end of the month for the previous month. So there is a question.
So the question is, can you provide a minimum or a maximum for the medical case manager caseload? You just said 45, but it's unclear if that is the upper or the lower limit.
So 45 is the upper limit. 25 is the lower limit. So you should be able, once your agency is sort of added into a portfolio, within the first 90 days, your agency should be able to recruit at least 25 clients. Any caseload below 25 is not considered full-time. Hopefully that answers your question. Okay, oral health. Agency must be Medicaid certified, again, and this goes across all service categories. Just to reiterate, Ryan White is the payer of last resort. If somebody has another payer source, we need to make sure we're tapping into that. For oral health, we have 3 categories we can pay for: preventative services, diagnostic services, and therapeutic services. Please note that we are not able to pay for any cosmetic services. So Anything that improves the smile of the clients, that is not something that Part B will pay for. But if it's something that sort of affects chewing and the ingestion of food and does not allow the client to sort of take their medication and has a just anything that can link to poor health outcomes, those things can be paid for. Please note that this year, IDPH will be implementing a fee policy for Ryan White clients earning above 100% FPL. So anybody making more than 100% FPL, the state will be implementing a policy where fees need to be collected from them. Again, we've talked to case managers about this over the past couple of months. We don't know what the fee is. We do not know when it's going to be implemented, and we don't know how these fees will be collected. All we know is for anybody above 100% FPL, there will be fees required to be collected. So again, more information to come about this. This also pertains to ambulatory care, oral health, mental health, and substance use. So those 4 core categories. Okay, moving on to mental health. Again, we can only pay for outpatient services here. It could be a group service or it could be an individual visit. AFC cannot pay for multiple visits in a given day. We've seen a lot of bills being provided or submitted and to provide where a client went to 4 groups in a day. That could easily wipe out the entire funding an agency has. So to make the funding sort of stretch more and serve more clients, AFC will not be able to pay for multiple visits in a given day. This does not mean that we can't pay for a medical visit and a mental health visit on the same day. This is about multiple mental health visits in a given day. Again, the Medicaid certified, payer of last resort, and then the same thing, there will be a fee assessed once IDPH releases that new policy. So there's a question.
So the question submitted is, which 4 categories does the fee apply to?
So the fees apply to ambulatory outpatient medical care, oral health, mental health, and substance abuse. So the 4 core categories. Okay, moving on to substance use. Again, this is going to be outpatient only. We do pay for group and individual visits. We do pay for methadone treatment as well. The same rule applies. We cannot pay for multiple visits in a given day. And then the same comment about fees. There'll be a fee assessed for clients making greater than 100% FPL. Let's move on to financial assistance. So financial assistance includes medical, transportation, housing assistance, utility assistance, and food vouchers. So those programs will remain this year. We will continue to support Ventra, Pace, Metra, Taxi, Uber, and some agencies have van services. The FPL level for utility assistance, housing assistance, medical transportation, and food vouchers will all remain at 500% of the FPL, and we will continue to support Aldi food vouchers and Joel Osco food vouchers. With financial assistance as it pertains to medical transportation, Rahman and his team are really working hard on making sure medical transportation is provided on a payer of last resort basis, meaning clients that have insurance, that have Medicaid, and are able to get a ride-free pass or able to get a transportation using their insurance, that they're making sure they are utilizing this as well. Again, all of these efforts are to make sure we're able to serve as many clients as possible. And if clients have other payer sources, they should be tapping in those first. Let's move on to legal services. Again, so legal services are very limited in terms of what services that can be provided. The only services that can be provided are permanency planning, do not resuscitate orders, preparation of powers of attorney, and preparation of living wills. There can also be interventions necessary to ensure access to eligible benefits, for example, discrimination, breach of confidentiality. There can be no criminal defense or class action suits paid for by the Part B legal service money. Move on to psychosocial services. This involves support and counseling activities. It includes child abuse and neglect counseling, HIV support groups, caregiver support groups. I will note that so far with the psychosocial funds we've been provided by the state, we've only been able, the agencies that are funded have done HIV support groups and support and counseling activities only. Again, for all service categories that are fee for service, we do require an invoice and provide as proof. Housing services. So we will no longer be referring to the Part B housing service as transitional housing. This recommendation came from the state because there's not a category called transitional housing funded by HRSA. It's called housing, so we'll be referring to it as housing services moving forward. We will continue to fund this service. We will pay for nights of stay, and there is no longer a client cap when it comes to housing services. In the past, IDPH has included caps, but those caps have now been taken away. The lead agent, which is currently AFC, can decide at any point to implement caps if we're seeing that the clients are not getting these services that they need. But at this time, there are no longer caps for housing services. We fund housing services by both HAPWA as well as Ryan White funds. And as stated earlier, no bridge units are funded by AFC this year. Okay, so let's talk about recruitment of clients. The AFC Care Plus hotline, the number again, sorry, that's actually, there's a typo there. The number that I gave to you earlier is the correct number. It's 312-690-8860. So take out the 784 if you have this printed. It is 690-8860, and we'll edit this once we send out the slides. Apologies. A client could call the AFC Care Plus hotline, and we have 3 individuals here at AFC that screen the clients for their needs and then refer to the case management agency of preference. We will continue to do that this year. Clients could also be recruited by the case management agency. They can walk in directly to the case management agency and say, I need services. That is completely okay. Not all referrals must come from AFC. Agencies can sort of do their recruitment as well. You can look at existing clients to see if they qualify for medical case management and recruit them that way. We have other recruitment strategies that agencies use, for example, flyers, pamphlets, word of mouth. Again, reiterating, not all clients come from AFC. Feel free to sort of do outreach to find clients that may need the service and enroll them into your case management programs or your other programs as well. Just remember that for the fee-for-service programs, case management is needed because those 2 documents I referred to earlier, an eligibility assessment and a care plan, are both required for the service to be billable. Also, to be cautious, when you recruit a client that walks in, please make sure you call AFC to confirm that the client is not already in case management. We would hate for you to do all the paperwork, sign all the releases, work with the client, and then find out later the client is case managed at one of our partner agencies. So please call us and we'll verify that information for you. Okay, so those are all the service categories. We're gonna move into provide data entry. Again, please make sure all data entry is done within 5 to 7 days of interaction for case management. Ideally, you should enter that information immediately if you're able to. And we don't want you to rely sort of on memory and what you did 7 days ago, because that won't be the most accurate information. So best practice, enter the interaction immediately you do it, but according to our policies, please do them within 5 to 7 days. Again, bill and data entry must be completed on the 10th of every month, and provide for non-case management services. So those are the fee-for-service categories. Provide entering the data by the 10th of the month for the previous month. An invoice is required for all services provided. The non-case management services, so fee-for-service, requires an invoice. And then a provide license is provided to all case managers and case manager supervisors and one staff responsible for billing. So if you have folks that don't have a provide license that need one, please reach out to us immediately. Hopefully everybody has the license that they need. And then in terms of billing, we only provide one. But if an agency is feeling or having any difficulties in billing because of the volume, and you need a special what word am I looking for? Yes.
An exemption?
An exemption, sure. and you need a special exemption, please reach out to me directly and we'll be able to talk through that as well. Okay, so the last slide we have here is about support. So we have AFC has standard operating procedures. We usually upload this on the link provided to you on the screen. That's a link that only our case managers or only folks that are part of our system or collaborative have access to. You cannot access this link by directly going on the AFC website. We call it our secret link. Only we have it. So that's the link for it. A lot of the information we've shared today, our standard operating procedures and policies, our AFC contact sheet that includes all our team members, what they do and their contact information. We have applications on there for housing and utility assistance. We have templates as well. So for folks who don't have an invoice template, we have templates available on the site as well. And then we have a referral sheet that has contact information for all our subcontracted agencies. And this is really supposed to help you facilitate referrals. So if you have a client that comes in and needs a dental service, you'll be able to log onto this website and see our oral health providers, and exactly you can call them directly to facilitate the referral. As mentioned, we are still going to be using AFC's ticketing system, and that is support@aidschicago.jitbit.com. This is a ticketing system. We're hoping all questions regarding Ryan White come through this system. Our goal is that we are monitoring, for example, we're monitoring the different types of tickets that come in, so that we can really do an evaluation to see if additional training is needed in certain service categories and certain procedures, if there's a large volume of tickets coming in pertaining to those topics. We also use this to keep ourselves accountable and make sure when case managers or administrators are asking questions, to make sure we're being responsive and making sure we're responding to tickets on a timely manner. We pull reports on a regular basis to see how many tickets are coming in a given month, as well as how responsive AFC has been with those tickets, and hope for improvement as time goes. So again, that's the ticket email. All you're doing is sending an email directly to support@aidschicago.jitbit.com, and that creates a ticket on our end, and we're able to respond to that. We're also going to continue to use Talent LMS, which is our training platform. A lot of our online trainings are on this platform, and we hope to build on these online trainings this year and really use this platform as a way for case managers to get a lot of their continuing sort of not CEUs per se, but just ongoing trainings for case management. Lastly, NowPow. NowPow is the resource inventory that we use here at AFC and that we've made available to case managers across all agencies as well. NowPow is a tool where you can enter different search criteria for service categories, for types of providers, for different geographic areas, and really pull up resources that may be helpful for a client. You're able to either print the resources for the client, you could email it to them, you could text it to them, but this is a really robust resource inventory that's updated on a regular basis. We will continue to support that, and we have been having conversations with CDPH and IDPH, and it looks like both teams will be supporting the NowPow system as well on a statewide level. So those are all the slides we have. The next slide is a question slide. So we would like to open it up for questions if anybody has any. I know we've answered some questions as we've gone through, but really wanted to sort of have this time for folks to ask any additional questions or clarifications.
Feel free to ask questions either verbally or through the chat function. Make sure that if you are doing it verbally, that you unmute yourself so that we can hear your question. Thank you. We have a question. So when might we expect budgets for 2020-2021 period?
That's a great question. We have been working with our finance team. I know they've been working on the budgets for the past week. I would say within the next couple of weeks, we should be able to provide to agencies their funding amounts. We will not be able to send out contracts until we receive award letters from our funders. But for now, what we can do is send out our intentions in terms of funding amounts. And I would say before the end of the month, you should be able to receive that.
And I believe that response also asked the question, when might we expect contracts for the fiscal year that starts in April of 2020?
Yeah, so usually, again, we don't send out subcontracts until we get letters from our funders, and we have not received letters from our funders for the next contract year, either March or April. But usually what's been happening over the past couple of years is that contracts are usually sent out in the month of May. So around May is when we send out contracts for both Part A or Part B. But prior to that, we should send out letters of intent that show budgets that we intend to fund, but it's not a formal contract.
And a follow-up question to that is, will we be given funding amounts or specific budgets determined by AFC?
Yes. So prior to the contract being sent, you will be sent funding amounts. Those will come directly from our finance teams. So it will be an email you receive from either Mark Schad for Part A or Jared Pavelski for Part B. But the goal is to send those out before the end of the month to agencies, so at least you have an idea of how much we intend to fund you for. Apologies for the delay. We were working with a Part B RFP. So I know they are working on it, and they've been working on it for about a week and a half. So you should all be receiving something very soon.
I got one. Yes, thank you.
Any other questions from the group, either verbally or through the chat function? Okay, great. Well, hearing no other questions, we want to thank you all for participating in this refresh overview of case management for returning organizations, case management and other services for returning organizations. We hope the information was helpful to you. Feel free to offer us any feedback or ways that we can improve future online webinars. We hope to have this venue as a venue to continue to share information and share programmatic and administrative updates with all of our subcontractors. So again, we thank you very much for your participation and look forward to seeing you all soon. Please note that we will send updated slides to all of the participants from the group, to all 28 of our participants. We will send you the updated slides. If you just want to review basic information from the slides, do note that under materials, there is a PDF upload of the current slides that we participated, but we will be updating them and sending them out to everyone. Also, if you are interested in reviewing this or forwarding this information to anyone, we will be uploading to our YouTube channel the recording of this webinar. And that should be up within the next couple of days. I would say by Thursday, that should be up on our YouTube station. So again, thank you all very much for participating, and we look forward to seeing you all.